Are you also suffering from tooth pain, sensitivity, along with a lot of discomfort? Well, I might tell you, cavities might be the reason. Yes, definitely, that black spot on your tooth, resisting you from having your favorite ice cream or hot chocolate maybe. So hey, I'm Dr. Prathibha Kamat. Today will make you aware about what exactly cavities is. So please watch the video until the end and don't forget to like, share and subscribe. It is basically the decay of tooth due to awful oral hygiene. I will tell you how. But firstly, how many of you just brush your teeth regularly after meals or at least twice a day? Just tell me in comment section below. This is exactly how a cavity looks like. After having meals, mostly people clean their mouth on a formality basis. But do you know that tiny particles of food are still there on your tooth surface and of course in between teeth? You are just creating an environment for bacteria to thrive on, creating a layer of plaque in due course. This plaque acts as a shield composed of rotten food and bacteria, which prevents saliva to reach the tooth surface. This is where most of your calculus accumulation occurs. Behind your lower teeth, it can be scraped out like that. In between teeth, and behind your posterior teeth, and behind the most posterior teeth, that is your wisdom teeth. Saliva naturally cleanses the tooth, but due to its inability to achieve the same, degrades the tooth surface, of course creating cavities. But no worries, you can always prevent it by having proper brushing technique and using mouthwash. For having proper brushing technique, check the link in our description box. So if you have one, you should definitely be visiting your dentist. He might diagnose you with a simple filling or root canal treatment depending on its severity. If the tooth is too much damaged, then you might even need an extraction. You should definitely be following up the treatment, otherwise it may get more severe and more serious. The more you wait, the more you suffer pain. You may emerge other dental conditions like periapical abscess, that is pus formation, periodontitis, which may cause loosening of tooth, cellulitis, osteomyelitis, etc. Always remember, prevention is better than cure. Other preventive measures include scaling in every 6 months so as to avoid any bacterial growth in your gum pockets. It is done by your dentist using water pressure so as to avoid any calculus deposition and tartar deposition. The other cases include nursing bottle caries, which are cavities occurring in infants and toddlers due to accumulation of a milk biofilm after the baby has its milk. So always make sure that your baby drinks some water after having milk so as to remove the milk biofilm and to prevent their teeth. Do not insert plastic nipples into your infant's mouth for overnight, as it increases the chances of caries and can damage their teeth. If your child is about 2 years, always make him or her brush their teeth regularly. Thank you for listening to me. If you find our videos informative, don't forget to like, share and subscribe Tooth Ministry. We will be back with another informative video. Until then, bye bye.